Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. And in this episode, we're going to talk about those amazing or sometimes not so amazing weight loss drugs, semaglutide and tirepizide. The brand names are, as you may well know, Ozempic and Wegovy, Zepbound. That's the weight loss name for Mounjaro. So these can be amazing in terms of their weight loss. And I've talked about them earlier, so you can actually access my earlier Instagram Live. So as a just very quick overview, in some people, they can lose with the semaglutide, that's Ozempic and Wegovy, at the highest dose, they can lose close to 20%, more typically they say 15% of their total body weight. And for the other, the Mounjaro, the tirepizide, and the Zepbound can be as high as 20 or so. Now, those are the highs. So let's talk about some of the negatives because that sounds fantastic. Well, first I want to tell you that data did come from a study. A study can be quite controlled. They can actually eliminate people who are not doing well. There's all different kinds of ways. So let's look at one study that was done with semaglutide. Now, in that study, which was industry directed, they created it, was designed to try to look at cardiovascular benefits. It was not designed to look at weight loss. So in order to be in that particular study, you had to meet certain criteria. You had to have had at least one stroke or heart attack. You had to not have diabetes, and you had to be overweight or more. And the study went for close to 3 years. Now, in that study, they did show a statistical reduction in the incidence of strokes and heart attacks in the treated group. And we're not going to go into that. I just want to mention that as a side note. But they did look at weight loss, although that was not the prime directive or purpose of that study. So you can consider this group more like an average group of people. As a whole, by the end of about 3 years, they lost less than 10%. So we're not talking 15, 20%. They lost less than 10% on average of their weight. So maybe what I'm saying, in a real world scenario, they don't quite deliver. That happens so often in studies, that the real world use of a drug is very much less in terms of its benefit than in a very specific study trying to achieve some sort of particular endpoint to try to sell the drug. But let's look at the data on weight that is lost and the spin that the drug companies put on it. And you may not think it's a spin, but I do. So when they look at how much fat is lost versus how much lean mass, which basically that means muscle. So I'm just going to call a spade a spade. Muscle versus fat that's lost. It's 40%. Now this is typical. 40% of all the weight that's lost is muscle. So that leaves 60% is fat. Now, muscle is precious cargo. Muscle is the organ in the body that doesn't just move your arms and legs so you can move and bend and lift and so on. It is the organ that is the dominant site for burning fat and glucose, also known as sugar. So if you want to be able to create energy and to burn fat and to burn glucose, you need to have a substantial amount of muscle. So losing muscle along with fat is not a good thing, especially as you age, because replacing that muscle can be next to impossible. So that is a really, really big deal. So let's give an example. Say someone is 200 pounds and they lose 10% over 3 years, just like in that study, real world scenario. So of that 20 pounds that's lost, 8 pounds is precious muscle, 8 pounds of that 20 pounds, that is really a big deal because that is your future for being able to burn fat, to burn glucose going forward. They spin it by saying, wait a minute, even though 40% of the weight that you lose is muscle, 60% is fat, the percentage of fat loss exceeds the percentage of muscle loss. So there you go. You're losing more fat than muscle. 2 thumbs up or 1 thumb up here. But here's the thing. That's not the critical thing. It's not the ratio of fat to muscle. It's absolute amounts, not the ratio. If you lose an absolute amount of muscle that's in the multiple pounds, that is separate from how much fat you lose. They're not a ratio thing when it comes to optimizing health. So that is the spin I'm talking about. That is not the way that people who are knowledgeable about fitness, body compositions think about it. They think about absolute numbers, not relative percentages. So what are some of the other issues that could be a problem? Well, one of the things that they tout as far as why weight is lost is that you have slower stomach emptying. That may make you feel full longer, and then you will not want to eat. Well, it can also make you feel really nauseated, and then you won't want to eat. But you're also going to feel like crap because you're going to feel really nauseated. And a fair percentage, now in my own practice, it's been around 30%, but I don't know for sure percentage-wise or who's keeping track of how many people try it and don't tolerate it because they just can't stand being nauseated. They say if you stick with it, and this is true for some people, if you keep taking it over time, the nausea will fade. What I have seen in my practice is that every time people get that weekly shot, for the next day, they feel pretty darn crummy, quite a lot of nausea. And then it kind of passes and they just put up with it. Are you going to put up with that for the rest of your life? I don't know. That would be your personal choice. That is not everyone. Some people have some nausea in the beginning and then it passes completely. So then for them, their symptoms and their side effects as far as nausea is just not an issue. In terms of slow stomach emptying, for some people, it goes too far. They have what's called gastroparesis. That's where the stomach essentially is kind of like paralyzed. That is a problem because you need to have a stomach that actually works to have a functional gastrointestinal tract. So that is a problem. And to this date, I don't think anyone can predict who will or won't develop that degree of gastroparesis to the point where it's truly a problem. Then the rest of the intestinal tract may be sluggish too. That can this is a potential problem, lead to what's called SIBO or SIFO. That is initials for small intestinal bacterial overgrowth or small intestinal fungal overgrowth. So think of it like stagnant water. If you have stagnant water, you are likely over time to grow algae and it gets kind of green and yucky. Well, what if your intestines, which is supposed to have motility, what if it's not really working very well and it's kind of like stagnant? You can have overgrowth of fungus or bacteria in great numbers that should not be there in the small intestinal tract, creating malabsorption. Then you could have malnutrition because the small intestine where you digest and absorb the nutrients isn't working right. Now, what about malnutrition? That is a problem even if you don't get SIBO or SIFO, because for most people, the main mechanism of why people lose weight with these drugs is because they really not only lose their appetite, but many develop an actual food aversion. Like the idea of eating becomes like terrible. Some people go so far as to set an alarm on their cell phone to remind them that they should eat, and then they kind of force themselves to eat. They do not love eating. In fact, they don't want to eat. Now, that sounds great, except eating is one of the joys of life. And so you're not going to really enjoy it. For some people, they don't just have a small appetite, they actually don't want to eat. They have a food aversion. Just the thinking of eating, it's just kind of sickening to them. And so they eat very little. They often make poor food choices, and then you will have nutrients that are deficient. And nutrients are not optional for health. Macronutrients like proteins, carbs, fats, micronutrients, the minerals, the vitamins, they are the building blocks of everything your cell does, creating structures and enzymes and different proteins and so on. Repairing, rejuvenating, all of that requires nutrients, macro and micro. So there's a variety of ways that someone on these various drugs can develop true nutritional deficiencies. Essentially, they are malnourished. Some people can't believe it. They're still overweight. They say, or even like they're obese. It's like, how can I be malnourished? Many obese people are actually malnourished. That is not a good, healthy longevity strategy. We do not want anyone to be malnourished. Now, what else can go wrong? Well, what about mood? There's actually some data that on these drugs, and some of the data has been more on semaglutide, not proof positive, but that it may cause erratic behavior, irritability, depression, and even suicidal thoughts. In fact, there is a warning on semaglutide that a side effect can be depression. So the FDA had them put an actual warning on their box. Now, what about another problem? It's rare, but if it happens, it is a big deal. And that is pancreatitis. So nobody wants to have pancreatitis. That's inflammation of that vital intestinal organ called the pancreas. Of course, if that happens, you need to get immediately off the drug and never, ever go back to using it. So you can see that there are a whole variety of potential side effects with the use of these medications. Once again, I don't want to underemphasize that there are some people, they really are appropriate candidates. Absolutely. People who are morbidly obese. They have tried a lot of different attempts to lose weight, and they are unsuccessful. They may have a lot of comorbidities like heart disease, other metabolic disorders, diabetes. They may have other problems involving their joints because they're carrying so much weight on their hips and their knee joints. So there can be, honestly, excellent candidates for these medications. The problem is, and I'm hearing reports of this, that so many people are going on these drugs who really do not belong on these drugs. They're looking to lose a relatively small amount of weight. Now, another drawback, which I didn't talk about yet, is that it's recommended by the drug companies and all the other organizations in medicine that once you start, you should be on these drugs for life. There is no exit strategy at all. Now, yes, there are people working on it, like, well, maybe if you get a really good diet and you exercise and you do all those things, then you can get off of them. To date, that has not been shown to be true. That may change, that if you adopt a really healthy lifestyle, maybe you'll be able to wean off these drugs and maintain the vast majority of the weight loss. But that remains to be seen. Right now, that is not what is recommended. It's recommended to be on these drugs for life. Now, what about trying to get off of them? Well, when people have tried, the best that they have shown that's definitive is keeping off maybe 20% of the weight. Okay, they will regain 80% or more. So that's not a lot. That's a lot of money. By the way, that's another problem, that For many people, they're not covered by insurance for these drugs. The cost is $1,000 or more a month, potentially for life. The cost may never come down. We don't know. So that's one heck of a lot of money to spend to lose, maybe if you're 200 pounds over 3 years, maybe 20 pounds, of which 8 are muscle. Now, what can you do if you don't want to go on these medications and you're not like extremely morbidly obese and you're not like on death's door, and if you don't do this, you really have no options? Well, there are options, and that's what I want to share. For example, there was one excellent study that showed that for people who ate, now I'm not saying everybody can do this, but there is also an exit strategy. You can actually maintain a more normal lifestyle after you get to your optimal weight. For example, in this study, they had all the subjects of the study eat 2/3 of their food for breakfast and 1/3 for a meal, whatever you want to call it, around 3 o'clock in the afternoon. So by 3:30 in the afternoon, all food was done. They fasted from around 3:30 in the afternoon until breakfast, which should be within a couple hours of awakening the next day. So it's a pretty substantial fasting time. And they ate, like I said, 2/3 of all their calories in the morning meal. By the end of 1 year, their insulin went down by over 50%. All of their inflammation markers went down. Their lipids improved. Every parameter of metabolic health dramatically improved, and there was significant weight loss. Now, when you have a situation like this, you're not resetting your metabolic rate. See, I think that's what's going on with these weight loss drugs, because so much of the weight loss is due to basically going on a starvation diet. That when you are on that type of a diet, you end up resetting your metabolic rate so that you then, even if you eat a normal amount of food, you will regain the weight. For example, if you have 2 people that weigh 150 pounds, but one formerly weighed 200 and lost 50 pounds, that is a huge amount percentage-wise, and got down to 150. The other person weighed 150 and has been stable at 150. The person who has always been stable at 150 can eat hundreds of calories more a day than the person who lost that 50 pounds to go from 200 to 150, even though now they weigh exactly the same. The person who lost the weight, eating the same number of calories, the identical diet as the one who had always been at 150, will gain weight because their metabolic system has been reset. So the one who is the weight loser to get to 150, it's almost impossible for that individual to maintain the weight loss because they have to eat hundreds of calories less a day than the other person who was stable at 150. And almost no one will live the rest of their life being hungry. So that is why that the idea that you go off these drugs is going to have a similar situation where the metabolic rate now has been reset. You take the drug away, their appetite will come back. Suddenly they don't have food aversion. They don't have the slower stomach emptying. Hopefully, that's the hope. And so, they just can't help themselves. They're always hungry if they don't eat a certain amount of calories, but on that number of calories, which would be fine for someone who didn't lose the weight, who was already at that weight, that person who lost the weight is going to gain weight. I hope you get that, okay? So weight gain is almost inevitable. To keep the weight off, that person who lost the weight would have to eat, like I said, hundreds of calories less than what their body would like. They have to be exercising probably an hour to an hour and a half every day. It's just not feasible for the majority of people. The weight will come back. That's why the recommendation is forever to be on the drug. Now, you have to go off those drugs at least a week. Some people say a month before undergoing surgery because of the slow stomach emptying. You can have food and liquids and such secretions in the stomach that after surgery and during can cause aspiration. So a lot of my patients who've had to go off to have some kind of surgical procedure, in just 1 month, you wouldn't believe they gained so much of that weight back because their doctors are so afraid that they'll have aspiration that can be deadly. So they'd say, go off the drug for a month. And they regain a lot of weight in that 1 month. And so that's not good. Then they're yo-yo dieting. And remember, they're losing a lot of muscle. The other thing that I have found is that most of my patients who have been, there's some that have been on the drug for well over a year already, like almost 18 months, they plateaued. And the weight loss plateaued by about 8 to 9 months, some even as early as 6 months. And then not only does it plateau, some of them start to creep up some. They keep off most, but they creep up some. So I think we're going to find that most of the weight loss occurs definitely within the first year, and then it either stays the same or there's a little creep up in the weight. And so if you weigh a great deal, you're not going to just keep losing weight. You'll lose a lot initially, and then it stabilizes. And I think nobody knows what to do. They don't. After you get to that plateau, if somebody really needs to lose more weight, what to do about it. Nobody knows. So what can you do? I told you could do like what that study said. Try to eat most of your food in the morning, and then the rest for what you might call a late lunch, early dinner, and then have a very long fast. And even if you didn't do that every single day of the week, like maybe you took Saturday to go out to dinner with friends or so on, you'll still get significant benefit. So fasting, with the fasting mimicking diet, the brand name for that is Prolon, has been shown in studies to help people to lose visceral fat. That's the dangerous fat. And not only do you lose the visceral fat, but you maintain the vast majority of your muscle. That is the goal. And plus, you don't reset your metabolic rate. So you do a fasting mimicking diet for 5 days a month, eat a healthy diet with a lot of plants, healthy foods, organic preferably, the rest of the month, and you try to not snack. Don't eat late at night. Try to eat more of your food in the first half of the day. And by doing a fasting mimicking diet for just 5 days a month, you can lose substantial amount of that inflammatory visceral fat and maintain your lean body mass known as muscle, and reverse prediabetes, early diabetes, lose fat in the liver, that non-alcoholic fatty liver disease that is so terrible. This is a much better way for the majority of people to go. Yes, it may be slower, but there's no endpoint where you will necessarily plateau. You can keep going, and you get to live a normal life with normal, healthy food all of the month. And if you add in exercise, that is dramatic. Exercising in the morning is much better for weight loss than exercising later in the day. Everything you can do to balance hormones. Make sure you have the right thyroid levels. Check thyroid with an advanced thyroid. If you are a woman, make sure you have the optimal estrogen, progesterone, and androgens. Those are managed properly, whether you're reproductive aged or peri or menopausal. Hormones matter. Estradiol, the estrogen of the ovaries, maintains metabolic optimization and keeps your mitochondria, the fat glucose burning organelle structures of the cell, working optimally. So you need to have optimal hormones for optimal health, optimal fat and glucose burning, optimal weight. And you want to avoid chemicals that interfere, those endocrine disruptors, plastics, flame retardants, and so on, herbicides, pesticides. So try to make your home with organic cleaning products. Try to keep your home with natural products as much as you can, like the best kind of paint and flooring. Try to eat organic foods. and work on stress. Stress increases cortisol, which increases gut problems, inflammation, and we want to keep inflammation down. As far as supplements, some of the really great ones are berberine and absorbable curcumin, myo-inositol, NAC and acetylcysteine. Those are just a few. Green tea, by the way, drinking 5 or 6 cups of green tea a day will help promote fat burning. Some people should go on those weight loss drugs. No questions about that. But most people can take a much more natural approach for a better long-term outcome and avoid some of the known and unknown. I can't talk to you about what we still don't even know over the long haul. Remember, these are drugs. They're not natural products. They're mimics of a peptide. They're not the actual peptide. They're not the same. And we don't know yet what we don't know. So just be sure you know what you're getting into. The shortcut may not be the best way to get to your destination. Think about it. Take care.